Hello, come on in, take a seat. My name is Lee and I am the medical assistant that will just sort of be checking you in, getting your blood pressure and vital signs, and sort of figuring out what is bringing you in today. Do you mind confirming the time of your appointment today? Okay, yep, I see you right there. Perfect. All right. So it looks like we have you on the schedule for some STI screening today. Does that sound accurate? Okay. And any changes to your emergency contact, insurance that we have on file, or pharmacy in the event that we have to send you medications? All is the same. Awesome. All right. And do you know roughly when the last time was you were screened for sexually transmitted infections? Maybe like a year and a half ago. Okay. All right. Let me open up your chart here. We have no medical conditions on file, just to confirm you're not taking any meds. Okay, and then no surgeries, right? You had wisdom teeth. Okay. And when was that? Okay. And then non-smoker, alcohol use kind of socially. Okay. And then any family history of breast, ovarian, or uterine cancer? Okay. And how old were they? Okay. Anybody else on that side of the family? And then as far as sexual activity status, we have that you are single, sexually active with male partners. Any forms of birth control that you currently use? Barrier methods, okay. All right. And then any history of ever acquiring any form of STI in the past? Okay. And what year? And you took treatment and all of that? Okay. Alrighty. Now, as far as today, are you having any symptoms that we should make note of in your chart? No symptoms at all. Okay. So no pelvic pain, urinary symptoms, burning when you pee, peeing too much, no vaginal symptoms, burning, itching, strong odor, or an abnormal discharge? Okay. And do you mind telling me roughly how tall you are? Okay. And do you know roughly how much you weigh? Okay. So yeah, we are going to just get your blood pressure, and then we will sort of figure out what the best method is for you as far as the screening goes. So let's get your blood pressure first, and then we'll sort of talk about all that, okay? Awesome. So yeah, you're just going to keep your feet flat on the ground for me. Alrighty. Alright, and I'm just going to slip this through your arm here. Go. Just gonna take a quick listen, so I'm gonna go silent here. blood pressure is normal. Let me take this off of your hair. You can slide your arm out for me. There you go. All right, so we are all good to go with the vitals today. Just put this here. All right, so let me close this up. So for STI screening, you have a few options. Now, the most thorough examination we can do is a pelvic exam, where we just take a look inside of the vagina, assess for cervical motion tenderness, see if we see any signs of infection. You also have the option of just leaving a urine sample, and we can test for gonorrhea, chlamydia, and trichomonas off of that. And then blood work would be like the full comprehensive panel, where we can also add on hepatitis, syphilis, and HIV for you. Do you have a preference as far as the mode? Would you prefer a vaginal swab, only a urine sample, blood work, pelvic exam and blood work? Okay, yep, that totally works for me. So Leanna then will draw some blood at the end of the pelvic exam to get the hepatitis, syphilis, and HIV. Technically, what you should be aware of is the only STI that you are not getting screened for today, in the event that she doesn't see any lesions, would be herpes. Okay, just wanted to make sure you were educated on that. But other than that, you will be screened for everything else. So what I'm going to have you do is I'm going to step out. And then I'm just going to leave a swab for the STI screening on the tray here. You'll get undressed waist down, but everything top-wise can stay on. And then Leanna, the PA, will do the pelvic exam. We'll do the vaginal swab to screen for gonorrhea, chlamydia, and trichomonas. And then she will do a manual exam with her gloves to make sure that she doesn't feel, or that you don't feel, any tenderness. And then she'll do the blood work for you. And then you will be all set for your screening. Absolutely. So I will go let her know that you are getting ready. There is a cover up there for you on the medical table, and she will be in shortly. You are so very welcome. I got you checked in, and we'll be back in. All right. Hello. It is very nice to see you. My name is Leanna, and I'm the PA that will be doing your STI screening today. So it looks like we have you on the schedule to do a pelvic exam. We'll be doing a vaginal swab to screen for gonorrhea, chlamydia, and trichomonas. And then I'll be just getting blood work before you go here for the full comprehensive panel of hepatitis, syphilis, and HIV. Lee, the medical assistant, was telling me that you've been having no symptoms or concerns though, right? Just being safe. Absolutely awesome. I always tell people that, interestingly enough, people who often get gonorrhea or chlamydia, the most common symptom is no symptom at all. You've heard of that too. Yeah, no, so that's great that you're taking care of yourself. So thank you for coming in. All right, so have you had a pelvic exam before? You have, okay. All right, so what I am gonna do then is we will get this over with for you. I know it's not the most comfortable thing in the world, definitely no one's favorite place to be. So let's just get this going for you, okay? Awesome, so I am just gonna move this a little bit here. If you wouldn't mind actually scooting down just a little bit more. Scoot, scoot. Good there. Awesome. And then let me grab the lights. Alrighty. So the first part of this is exams. I'm just going to take a look on the outside to make sure I don't see any suspicious moles or lesions. So you'll feel my gloves here on the outside. And you just let me know if you get too uncomfortable. And of course, course, you haven't noticed any suspicious bumps? Okay, so no pain on the outside. Good. I'm not noticing any redness or swelling or signs of irritation. I don't see any suspicious moles or bumps that may need to be tested, so that's good. Alright, so we are ready now for the internal speculum exam. So I'm going to get some warm water started here. Alrighty, and so this part here is the speculum exam, okay? And then of course, if you're too uncomfortable or you need me to stop anything, you just let me know. All right, so you are going to feel my gloves here on the outside. You're going to feel some of that pressure here from the speculum. And I see your cervix perfectly, so that's good. I'm not seeing any abnormal discharge, any foreign body. We are going to take our STI swab here. And this is about the size of a Q-tip, so very, very small, okay? Just gonna feel that around your vaginal wall area, okay? Here, and then we will send this out to the lab. So the swab again is for gonorrhea, chlamydia, and trick. But like you were saying, there's no signs of infection at all that we should be concerned about. So I'm going to take the speculum out now. Coming out. There you go. And then the last part of the examination is when I do an internal exam with my gloved finger. To make sure that you don't feel any tenderness or anything like that. Okay, just want to make sure you're okay with it. All right, you are going to feel my glove internally here. Just kind of making note of each side. No tenderness here, right? Good. I don't feel any enlargements or masses. And then what about this side here? Feels okay? Okay. Okay, your manual exam is all done. So we are just going to switch the gloves out here so that I can quickly do your blood draw as well. But pelvic exam-wise, you're all done with that. All right, do you have an arm preference at all? Just do this one. That's no problem at all. And I'll get this over with real quick for you. So I'll just take your arm here. If you could just straighten it out for me. Perfect. All right. First off, we're just gonna clean the area here. Making sure everything is nice and clean before we do that blood draw for you. Do you ever get lightheaded from needles or anything? You do pretty okay? Okay, good. Just want to make sure. is nice and prepped. So what's going to happen here is you are going to feel a little bit of a pinch, okay? All right, 3, 2, there you go. We just need one of these, so you're doing great. Almost done. All right. Let me put some pressure on your arm there. Just going to kind of hold that in place to stop any immediate bleeding. Awesome. And then I'm going to keep that in place while I just apply a little strip here, just to kind of cover up the site. There we go. Okay, just going to place this on that arm. And perfect. Your blood draw is all done. Yes, that was it. That was completely it. Alrighty. Well, let me find my sanitizer here. Do you have any questions at all about what we did today? Everything was pretty straightforward. Alright, so I will let the girls know up front everything that we collected today. The blood work comes back a lot faster than the swab, so you'll probably get your results by tomorrow. And of course, I will call you if there's anything that is not normal. Yes, exactly. All right, well, the girls will see you up front. Take your time getting dressed. You're not feeling lightheaded, right? Okay, good. Alrighty, well, you take your time in here. It was nice seeing you, and you call if you need absolutely anything or you have any questions. You're so very welcome. Have a good day.